Hi, Betty. How are you?
Hi, I'm doing good. How are you?
Good. So you are coming to us from Dr. Henry Mentz's office where you had a facelift last year and you had a certain combination of procedures. You had a facelift, a CO2 laser, and am I getting this right? Half of a lip lift?
Yes, I had the left side of my mouth lifted, and I
So
also
can you
lower bluff
Oh, and a lower bleph.
and a
You
necklift.
look incredible.
Thank you. Thank you.
And thank you for coming and speaking with New Beauty to talk about your procedure. So tell me a little bit about what made you decide to get a facelift and this combination of procedures.
Okay. Well, I've always been good about my skin. It's always been important. I've been on tretinoin since it was first approved for preventing wrinkles back in the late 80s. So it's been something that's been on my radar for a long time. A facelift was always something that I considered in the back of my mind. But it wasn't until in 2023 when I had weight loss surgery and lost a tremendous amount of weight that it really became front and center. And that was because of all of the fat loss in my face and the sagging skin, and it just exaggerated everything. So that was my main impetus. Also, at my age, a lot of my peers and friends, they're getting facelifts. And one of my really good friends had a deep plane facelift with Dr. Mentz. And that was probably the thing that really pushed me
Yeah.
over the line and made me choose Dr. Mentz.
Well, a lot of people are experiencing this right now where you're successful after weight loss and then the fat in our face is kind of holding everything up for a very long time. And once you lose it, it's you age quickly. So, do you mind sharing how old you are?
I'll be 71 in a few months.
You look incredible.
Thank
You
you.
look so good.
Thank you.
So tell me a little bit about your procedure. What was it like and what was recovery like?
Okay. Well, I had a deep plane facelift. I had a lower bleph on both eyes, lower eye lift. I had a lip lift on my left side only because my left side of my mouth had always just been kind of, and it was getting worse
Yeah.
with age and with the fat loss and whatever. And I had a neck lift. And then he did the Fraxel laser on my face and my neck and even the backs of my hands because of aging there.
Wow. Was the everything done on the same day or
Yep.
was your procedure done in stages?
It was
All same
all
day.
done. And since then, I had that done about 9 months ago. Since then, I had another Fraxel laser treatment just to kind of keep things up. And I intend to keep on doing that too. And as the years go by, to keep things, you know, keep status quo as long as I can.
Well, you are exuding youth. So
Thank
you
you.
made all the right choices. And I love that you only had half of a lip lift just to
Mhm.
make balance your features out and make everything more symmetrical. Because,
Exactly.
yes, go ahead. Sorry.
I don't think that's something that a lot of people do.
I was just going to say that.
Yeah,
Yes.
but I knew it was kind of like, well, I have nothing to lose really because my lip on that side was just so thin. It was one of the things that bothered me the most about my face and my neck because after the weight loss, my neck, I mean, I couldn't, my profile was just
Yeah.
not good.
Yeah.
So I really wanted to restore that jawline and definition and get the sagging skin off my neck. And that was, like I said, that's probably the thing that really drove me
Yeah.
to start seriously thinking about the procedures that I had done.
Well, that's something that you can't really address with a lot of non-surgical procedures or your skincare. And like you said, you can take care of your skin as much as possible. But, when something major happens like that, you have to do something to counteract gravity. So
Like,
wonderful. What about your recovery? What was that like?
I thought it was pretty easy. I credit a lot of it to, well, the care of my surgeon and the team. They were great, and the nurses that came to my home to help me make sure I was doing everything right once I was at home. I was also doing Instagram videos, so I was keeping my progress, making a record of my progress as it went along. I really felt like at 2 weeks, I still had some bruising and discoloration and a little bit of, asymmetry from my lip lift. Things were still healing, but I went out in public. A lot of my friends saw me. I mean, I didn't just sneak to the grocery store with sunglasses on. I put on makeup and I went to an event,
Wow.
and I know that a lot of my friends at this event knew, and they were really checking me out, but I could tell that a lot of them, and the ones who didn't say anything, I could tell they were like, "Okay." So,
Yeah.
at 2 weeks, I would say there was very little pain with any of it. I can't think of any real pain at all. I mean, there's a lot of odd sensations and a little
Right.
discomfort, and your skin feels foreign because a lot of it's still numb, and you can feel it with your hands, but you don't feel your hands on your face so much, so it's kinda hard to describe, but it's a little bit more of an adjustment than I would say discomfort. There's very little discomfort with it.
Well, your results look very natural. And I love too that we're in a place where you can go to a party and people know that you had something done. And we're just more open about having surgery these days, I
Yeah.
think.
I've been very open. I was open about my weight loss surgery because I felt like this is something that can help a lot of people.
Yeah.
And this was just before the, GLP-1 drugs became available. It was just a few months before that became a thing.
Right.
And so it was one of the few options other than just, eat less, exercise, and,
Right.
um, I was very open about that, and a lot of people are not. And so being open about my facelift was something that just flowed from that. That's just I feel like, you know, why not help somebody else?
Right. And you're being authentic and it's part of your journey. And I agree. I agree with being open, even though it's a personal choice. And a lot of people are dealing with this right now. So do you feel that your decision to have a facial procedure was part of this weight loss journey? Was it like the final step?
It was because, in addition to my face, I also had a lower body lift and brachioplasty. I had excess skin on my upper arms. I had that done too. And
Yeah.
so that was my first big major plastic surgery, and I was very apprehensive about it. But when I saw how well it turned out, and I was also concerned that at my age, my skin might not, you know,
Right.
wanna recover as well as maybe it would have 10, 15,
Yeah.
20 years ago. But it was very encouraging, the results. And then I was like, "Well, now my face kinda doesn't go with the rest of me," and that was part of, like you said, it's part of the journey, the continuation of the journey, and I think the final little cherry on top of the whole
Absolutely.
transformation.
I mean, it's really one thing to be successful with your weight loss, but to be able to go out and celebrate it and wear sleeveless tops and not feel, that everyone's looking at your sagging skin, but no one's really looking.
I know.
It's you. Right. Right.
Well, everything that I think that I do and that I did for me. My husband didn't care. He loved me when I was heavy, he loved me when I was thin, he loved me when I had all the sagging skin, he doesn't care.
Yeah.
But I did. When I would look in the mirror, it's like, "Well, I've come this far, and then there's this, so let's just
Right.
finish this."
Yeah. Well, you look amazing.
Thank you.
Thank you for sharing your story. Is there a tip or a little nugget that you can share with anybody watching who is considering this, having a facelift in their 70s or, post weight loss? What would you tell them?
Yeah. Well, I would say, number 1, I don't think you're ever too old. I think that's a discussion you need to have with your really qualified plastic surgeons and gather a lot of data. There's so much information out there, online, and there's Facebook groups that you can participate in so that you get kind of the real truth from people who've been there and done that. And interviewing, with more than one plastic surgeon, and also having conversations with somebody. I was very fortunate to have a really good friend who had a fabulous result from Dr. Mentz. And so that point, and she was about a year ahead of me, a little less than a year, about 8 months ahead of me. It was kind of like, well, just to be on the safe side, and so I can say I've covered all my bases, I'm going to need to probably wind up ruling some people out. And
Right.
so I would recommend do your research, gather your data. Don't be afraid to
Yeah.
pursue it at your age, and get into a community where you get support and information.
Well, wonderful. Thank you so much for sharing your results with us. Again, you look incredible. And thank you again.
Yes, you're welcome.
Thank you. Hi, Dr. Mentz. How are you?
Oh, great. How are you this morning?
I'm wonderful. Thank you. We just talked to Betty, who underwent a deep plane facelift, a neck lift, a blepharoplasty, a laser, and half of a lip lift. So I'd
Right.
love to know, how do you decide which combination of procedures is best when you are treating a patient?
Well, there are a couple of issues I think that are important. I think the first thing is patients have to understand where they want to go. And I often will use, in fact, every time I'll use Vectra, which is three-dimensional imaging. And we look at the patient's picture together on screen. And they'll point out to me the areas that are of concern. And sometimes there's an area that requires or that they're interested in improving. In order to improve that, you have an adjacent area that has to go with it. So sometimes you can't do one offs. You lift the neck and you have a redundancy in the face. You have to lift some here and you have some redundancy here. So it's all sort of connected. So now and then we can do a singular operation, but usually in order to get everything to look natural and beautiful, we have to lift everything in unison. And that's the other part of it as well, is it's not just lifting, it's skin quality, it's soft tissue descent, it's volume restoration. So all those things have to be packaged together because people age differently. And so
Right.
each of those things has to be attacked in a separate way, but in unison so that it looks beautiful and natural.
What makes a patient like Betty an ideal candidate for this type of comprehensive rejuvenation?
Well, I think the most important thing is her goals. Lots of people are happy looking old, and that's fine, but for Betty, she came in and she was interested in sort of some rejuvenation and looking fresh, and there are many patients, I think lots of patients who feel younger than they look. And
Right.
there's sort of a disconnect there, and they look at the mirror in the morning and they see someone older than the person they feel, and they go into work or they see their friends and their friends ask them why they look tired or what happened or why they look so sad, and they feel good. And so it's not always a mirror of their feelings inside. And so she was ready for a change. And the tough part about Texas is Texas sun is brutal.
Yeah.
It's brutal, and it takes away elastic, it relaxes the skin, you get deterioration in the skin quality, brown spots, fine wrinkles, large pores, and the skin relaxes and you get more wrinkles. So, uh, Texas is tough, and so, and life is also tough too, and, I see many patients who've had life events, whether
Right.
it be a child with issues or a parent they have to take care of or a spousal issue. And those things create age as well. And so many, many patients come in and say, I looked pretty good until 2 years ago and I aged 10 years.
Right.
And they blame it on an event. I think the event has something to do with it because life is tough. It's not
Right.
always kind. And so they don't want that to be a reflection of the way they look to other people, and they want some of these events they'd like sort of, I hate to say erase, but to go back to where they started. And
Right.
so Betty was ready for that. You know, she has some Texas sun, and she posted her stuff on the internet. Like I don't think she'd ever done TikTok before. I don't know, but she posted something, and everybody was attracted to it. They went, okay, what's going to happen? What's going to happen?
She's such a great testament to your good work, Dr. Mentz. And I think people just love a good, authentic story that you can relate to. So Betty's wonderful for sharing her story with everybody.
Well, you both are very generous. Thank you, Betty. Yes.
What should readers and followers know about deep plane facelifts?
Our deep plane facelifts, I think the first thing is they're not new. I did my first one 1990, if you can believe that. I did three
Yeah.
cadavers. My first three patients were already dead. Okay. But it was a very new technique back then.
Yeah.
And so it was something that we had to practice up on. And so 1990 in there, I did my first case, and she's still a patient of mine. The amazing thing is that was 35 years ago. She still hasn't required a second facelift. Now that's pretty unusual, okay?
Wow.
But through those years, I've done plication, smash lifts, Tenard's sort of Mac lift. There every 5 years there's another twist that's introduced that maybe is faster and easier and better. But I always end up going back to the operation that has the most durability. Now, it doesn't mean it's the easiest one,
Right.
and it doesn't mean the recovery's the easiest, but I believe in my hands it lasts the longest, which is very important to me. I don't want to see it back, and I see tons of patients back have had many lifts and sort of you get back to work in a couple of days kind of thing, and they're back in 2 years wanting another facelift. That's just not right. I think that there are better operations, and I don't use the same operation every time as well. So deep lifts are special because they incorporate the soft tissue
Mhm.
that's descending and reposition it as well as tighten the skin. And that repositioning, I think, is much more durable than just suture lifts and those kind of things in my hands.
So the technique you use is patient dependent.
Exactly. I probably use 6 different techniques. Some patients come in and they're blondie tennis players, and they only have skin laxity and sun
Right.
damage. And their jawline's good, their neck's good, and so really they just need skin tightening and lasering. Some patients, their skin quality looks good, and they have soft tissue descent. They're saggers, not wrinklers, and you have to do more repositioning on those patients. Most patients have a blend of all those things, and so you have to take care of skin quality issues, skin laxity issues, soft tissue descent, sag, and volume deficiency. So some people get hollow in the cheek, the temple, around the mouth, and the neck sometimes too. So each of those things need to be rebalanced in order to achieve a natural and beautiful look.
Speaking of balance, you made the choice to do half of a lip lift. So I'd love to hear about that because that's not something you hear about every day. And I'm assuming it's for symmetry and balance.
Exactly. And, lip lifts, lots of people come in and ask for that operation, but it is an unusual operation because it only lifts the central portion of the lip because you tighten skin under the nose. And so for some patients, it can leave them with a little bit of a frown. And
Got
so
it.
you have to choose the right patient. So probably every 6 or 7 patients that come in requesting that operation, I talk them out of it because I know they're not going to be happy. But there are some patients that have not a lot of tooth show and a
Mhm.
long upper lip, and the operation works well, especially when you combine it with a deep layer lift. So you're lifting the corner of the mouth as well. Now, for Betty, she had a little longer lip on one side than the other. And I've done that a handful of times, probably 5 or 6 times, where we just lift one side to improve symmetry. And it works well. And the nice thing is the scar is by it. It's underneath the nose. And it heals well. So I think we got her pretty close to perfect.
It's undetectable, really. It looks
Yeah.
so natural. You did an amazing job.
Oh, well, thanks. So thanks.
Well, thank you so much for coming and speaking to New Beauty today about your procedure and about Betty's case. We really appreciate it. Thank you, Dr. Mentz.
Well, thank you. New Beauty is great. I think it's the best magazine out there if you want to learn about plastic surgery and rejuvenation. And
Thank you for bringing Betty's story to us.
yes, thanks.
Wonderful.
Thanks, Betty.
You're welcome.